Good afternoon, everybody. It is 1 o'clock, and I am pleased to invite you to welcome you to this COVID-19 webinar on behalf of the National Institute for Occupational Health, and particularly the efforts of our epidemiology section, that's epidemiology and surveillance section. The topic for our session today is the COVID-19 Occupational Health Surveillance System, the OHSS, for South African workplaces, and providing an update for that particular session. At this point in time, I just want to give you a sense of what the lineup is for our program. We first have the overview of occupational health and safety, including the data submission guidelines and templates, when they must be submitted and what to submit, by Dr. Nisha Naika from the NIOH's epidemiology section, as well as that is followed by how to submit, and that is the Nextcloud platform by Mr. Faisal McKenna, and then how to submit on the API platform or using that particular tool by Monty Ram Bau from the IT section here at NIOH, and then also how to submit on the CMO platform, and creation of reports by Mr. Herman Leroux of the CSIR, and that's followed by what happens to the data after submission by Dr. Jabun Tweni from the CSIR, and the dashboard overview by their colleague Mr. Rekhabile Kutlang from the CSIR. I now immediately hand over to Dr. Nisha Naika, who is the head of the epidemiology and surveillance section at the NIH, who's going to start off with our first two topics on the program. I hand over to you, Nisha.
Thanks, Ashraf, for that introduction. So I hope you can see my screen. I'm going to share my slideshow.
Yes, if you could maximize it, thank you very much. There you are. Thank you.
Okay, so thank you everyone for attending, and I hope this will prove to be useful. There might be a bit of repetition going through, but I think it's will just help to reinforce what we want to share. So there is a lack of occupational health data, especially around COVID, or there used to be a lack, and how it impacts on the various business sectors in South Africa. So although there were initiatives initially for data collection and reporting by employers, this was not coordinated or fully implemented at that stage. So the Department of Employment and Labor, together with the Department of Health and Business Sector and Labor, then drafted the directive that was released on the 28th of September, making it compulsory or legally enforceable for employers with greater than 50 employees to submit data to the National Institute for Occupational Health on symptomatic employees, their vulnerability status of their employees in their businesses, positive case data, and return to work or health outcomes. So this became official on the 1st of October 2020, and all businesses fulfilling this criteria need to submit on that database. So just a brief overview of what is the purpose of surveillance. And especially for this occupational health surveillance that the OHSS deals with. So it is to develop a system to monitor workers in various economic sectors, both in the public and private sector. It allows us, and it will allow us to identify in advance the sectors or companies and occupational groups that are high risk of infection, so that we can inform appropriate interventions, either policies, programmings, assign specific resources to the different sectors that are at high risk or have a high number of infections. Ultimately, it will allow us to evaluate the impact on human resources and the economic impact on the various sectors. It will show us the trend of the pandemic in the various economic sectors and the national trend of employees as well. And eventually we'll be able to see what the impact of interventions that were in place in the workplace, and because we'll be able to evaluate going forward. We can also pick up then key scientific questions that might require further study or investigation. So that is the basis for developing such a system. So the occupational health surveillance team is made up of the public sector, which is run by the Department of Health, together with Department of Employment and Labor, and then the National Institute for Occupational Health, the National Institute for Communicable Diseases, the CSIR, business, and as I said, involvement of labor as well. So this initiative started with the Department of Health, and together with all the different partners, the occupational surveillance system came about. So it's made up of a steering, so there is a very good governance structure in place with a steering committee made up of government, business, the scientific community, and technical experts. We then have a data management committee, which is made up of the team from NIH, CSR, and business experts that assist us with the actual database and developing the dashboards, etc. And we have a scientific committee that that looks at the data quality that we are receiving and will produce reports and advise on the information that should be going out to the public and the stakeholders, particularly the businesses. So this data system, the occupational health surveillance system, will then be integrated with other surveillance systems or other data collection activities that are currently out there, such as the NMC database, the Sentinel Hospital Admission database, the lab testing data, which includes the private and public sector labs, the compensation fund, other information from Department of Health, Department of Employment and Labor as well. So it will eventually integrate multiple data sources to form a more comprehensive database. So we take confidentiality very seriously, and all the data within the data lake will be anonymized, and any identifying information is removed within 6 weeks of submission into the data lake itself. And all the data is securely stored and processed within the NIH. And all systems used for the data collection, storage, the processes, etc., is reviewed on a regular basis for any security vulnerabilities. And so, I mean, a lot of attention is being paid to not letting private information about businesses released at all. So there are strict measures in place. So the first step, and we will discuss this later as well, is the business registration. So before anything can happen, all businesses are supposed to register on the system, and we require specific information that has to be entered. So the businesses can register, the head office usually is registered, and then the branches do not need to register themselves as well, because if you look at it, the province and districts for the branches may differ, and so we will be able to pick up it is a branch. The contact information is important because this is where your access details are sent to. The sector affiliation is if a business is registered or not, is a member of some sort of affiliation, like the banks in the Banking Association of South Africa, that sort of thing, or the mines in the Mineral Council for South Africa. So that is what we mean by sector affiliation. We require the numbers of employees, so total employees, and the numbers of females and males must equal to the total, as well as job categories must equal to the total, otherwise the registration will not go through. And then you need to choose your submission process, and that will be described going forward, I mean, in the later presentations. So now I'm just going to touch onto the data submission guidelines, because this is where our main challenges occur in this system. Okay, so there are, I'll say 4 categories, but we have 5 here that need to be submitted. So the first one is the vulnerability assessment. So after you register, each business is supposed to have done a vulnerability assessment, and that should have been done right at the start of the pandemic, and this has to be submitted. Then symptom screening, and then positive case, and included in the positive case data submission platform, you will include the high exposure work contacts, so not community, but work contacts, and then it'll return to work with the outcome. So I'm just going to go through each of these different categories in a bit more detail. So the first one is the vulnerability assessment, and this is the once-off data submission. So you do not submit it on all employees, but only those that are vulnerable. And they are on the templates, there are certain information that is, or data that is compulsory, and some are optional. So compulsory meaning that you have to submit this. And what's important to note here is that the vulnerability assessment can be a yes or no answer. The variables or the data that is highlighted in blue is optional. So you will only submit that information, such as the age, the pregnancy, the comorbidities, if the employee has given you consent to do so, because this is confidential medical information and you need consent to submit it. So for the vulnerability assessments, it's important to note that you only need to say whether the employee is vulnerable, and then the other demographic data, including the job category, sex, age, district, province, state. The business ID, is the ID that is sent to you after registration with your access code, and that is a long number that needs to be entered every time you fill in any of the templates, either on CMO or on the Nextcloud system. The employee ID can be a unique ID that has been generated by the company itself. So it could be your company ID for the employee ID, or it could be your South African national ID number. It's up to the person filling it in to decide which one they would go with. So the South African national ID is not compulsory on this form. And I just put this up here because this is the templates that can be found on our website, or it will also, if you choose the CSV Nextcloud system, it will be emailed to you as well when you get your access details. So if you look at this form, there are columns that have to remain this way. So you are not allowed to add extra columns or remove some columns. They have to remain as is. The employee ID, as we said before, could be the national ID or a unique ID that the business has given that employee. The business ID we've mentioned, the date is for the date when you are submitting this information, and the rest. You will see on the first spreadsheet, it is the actual spreadsheet that you will fill in. The list, the second spreadsheet is labeled list, which just provides more information on each of these columns, and the dictionary again also provides more information on each of these columns. The templates are a drop-down box, have drop-down boxes for each of the columns, so you just need to select, hopefully making it easier for the submissions. So the point to take home from here is that these templates are not to be modified in any way. They can be uploaded as an Excel spreadsheet or a CSV, saved as a CSV file and uploaded as that. It cannot be converted to a PDF or submitted in a Word format or any other formats, as the system will not be able to process that data. So only Excel and CSV files should be uploaded. Then the screening data. So this is, businesses are supposed to collect data daily from all employees that attend the work site. So you need to then collect this information at the end of the week. Just collate all the information on all those that were symptomatic. So all we require is the data on a weekly basis for only symptomatic employees. And again, there are fields that are compulsory and fields that are optional. And the compulsory fields is this, it's very similar to the vulnerability data set, and you'll see it'll be similar in the positive and the return to work. So what is important here is just to state whether the employee was symptomatic. So you would, since you're only sending symptomatic people, you will say yes. The items in blue are the actual symptoms. Oops. Sorry, I think I clicked something. So the items in blue are the actual symptoms, and this is optional. It's preferable that we get as much data as possible, but we do acknowledge that some businesses may not be collecting the detail as we require it, so it has been made optional. But for a surveillance system to be as useful as possible, the more data, the better. Okay, and again, also on the screening data, the employee ID can be a unique ID generated by the employer or the South African national ID. What is advisable is that if you are using an employer-generated unique ID, it has to be the same in all the templates going. That is the vulnerability, the screening, positive, and the return to work, so that we can match the data to the specific employee. The positive test case data, this is submitted when there is a positive case, and it can be submitted on a weekly basis as well. So if you look here, the majority of the fields are compulsory, and it's important to note here is that we require the employee ID is noted twice. So if you have used a unique employer-generated ID in the other templates, this must be added here. And in this form, it's compulsory to add in the South African national ID. And then the other compulsory data. You'll see the first part is very similar to the other forms that we've already discussed. Then the new items will be the test date. So when did the test occur? The test type, most frequently it's been PCR, but we're now aware that some organizations are also doing antigen testing. So if this is known, you would add it in. We need to know whether the person had symptoms before or not, so yes or no. Then we also ask for the high-risk workplace contacts. So here we just need the number of the workplace contacts. And there is a specific definition for high risk in the guidelines, meaning that they need to be within a certain distance. It's 1 meter close to each other, not wearing PPE, and for greater than 15 minutes at a time. And we just need the numbers. No details about with names, etc. need to be submitted for the occupational health surveillance system. Then we require to know whether they were person had some sort of a vulnerability, either comorbidity or risk factor, like age greater than 60, and what happened after the result was known, and then the type of contact that this employee had before on possible contact for exposure. So it could be work, could be community, family, large events, so any type of contact that we think resulted in the transmission of the virus. And so it's important to note it does not have to be a workplace contact, it could be a community contact. The reporting action is something that is not compulsory, but it's but again, the more information we get, the better the system is. Then the return to work or health outcome template is the first part, again, is the demographic information. And I want to stress that the business ID must be the long business ID completed in full in all the templates that we've described thus far. So it's one business ID and you put it in all the templates that you use. Here again, the employee ID can be either the national ID or the employer generated ID. What we require here is to know whether the person was hospitalized or not, and if hospitalized, what was the date of admission, what happened after hospitalized, was there a discharge or a death, and then the outcome date. And if the person was discharged, when did they return to work, and what was their fitness level on return, and then the compensation claim, whether it was submitted or not. The rest of the information is not compulsory, but if you have it, it would be advisable to fill it in. So the process to be followed, and I think it will be discussed again, is that you have to just assess whether you have 50 or more employees per site, and then it's advisable to read the updated guidelines that can be found on our website, and this will inform you on the processes and describe everything I've described so far. You register your business, you will receive a confirmation email immediately upon registration, and within the day or the next day, you should receive an email with your business ID, username, and password. And then once you get this, you will then can start your submission process. So thus far, we've had about over 2,900 or so businesses that have registered, but this represents a very small proportion of all the businesses in the country. The other challenge is that the data quality, as we've spoken before, was initially at the start was a bit problematic, but now with the refinements of the system, this is improving. So the main thing is that we need to increase awareness of the system and the directive itself so that more and more businesses start registering and supplying the information. So that's my presentation, and I'd just like to thank everyone that has supported the system going forward, and all the access details or information here is, I'm sure Ashraf will put it up for you at a later stage. So that's it from me. Thanks, Ashraf.
Thank you very much for that. That was Dr. Nisha Naika, the head of the epidemiology and surveillance section here at the NIH. And she's dealt with setting the basis for our program, both in explaining the overview of that as well as the importance of data submission and guidelines. This is a very important tool, a national tool that helps us in the overall battle with regard to COVID-19 and the various challenges that we're facing. So it's important that all of you as participants take as much from this in order to ensure that your workplaces are in fact properly registered on the system and that you are submitting the data that is required. A quick announcement, we have reached the maximum of 1,000 attendees for this particular session, and therefore I have posted the YouTube link in the chat box. Please share it with your colleagues who couldn't manage to get into this particular session, as well as I've indicated that all the recordings and presentations will be available after this particular session. I now hand over to Mr. Faisal McKenna, who's the IT person from the NICD, and he's going to deal with how to submit on the Nextcloud. I hand over to you, Faisal. And a reminder, while Faisal is doing that, please type your questions in the Q&A box and general comments in the chat box. I'm going to ask all our panelists just to make sure that they can get into the Q&A box and answer the questions that are already listed there. Okay. Faisal, are you there? Okay. And for those interested in the CPD certification for this particular session, we will be sending out a link and a password for you to do an online CPD test. And once you meet the requirements there will be a certificate issued to you for those who require the CPD certificates. For others, we will be doing the general attendance certificate for you and be circulating that as soon as we can manage that in terms of the load. Okay, so could I just check with Faisal if he's there? Oh, apologies. I'm looking at the wrong program. I should be asking Dr. Jabum Tsweni to share his presentation.
Thanks, Chair. I hope you can hear me. I'm just going to try and share my screen now, if you don't mind. And then you let me know if you can see it. Is it showing?
Yes, it is showing. Yeah. Please proceed.
Okay. So I think I'm just going to, based on what Nisha, I just want to hide this. Based on what Nisha was talking about, maybe before the colleagues come in and explain how to actually submit the actual data, just to give a high level overview of the system and also explain just briefly the different options that the different companies could choose in order to submit the data. So with regards to the surveillance systems, we have tried to accommodate the different needs from different companies. So we accommodate companies who have their own tools. For example, they may be having their own symptom screening tools, contact training tools, and so on and so forth. So we accommodate those. But we also accommodate companies that may not have their own tools, which I would explain now, where they can use one of the tools that we have deployed, which the colleagues will explain in terms of CIMO, which is a web platform, and they can submit, for example, on a regular basis, that particular data. But we also have the manual option, so to speak, where people who may not necessarily want to use the tools because they either don't have the infrastructure or they don't have the people who may manage these tools, and they also don't have their own tools, they can use the templates that Nisha spoke about to complete the data on a weekly basis or when the data is available, particularly on positives and the other cases, so that they can submit it then into our data lake at NIOH. So you would notice that the system is sort of using different components, but one thing, as Nisha mentioned, all of the data that is being shared, even on the manual system, is only available to you and the administrators at NIOH, so nobody else who is not supposed to see your information has access to that, as much as in many of the other information like screening, there's no personal information that is being collected. And I think that all the templates are available on the website, as Nisha has explained, but I just want to maybe go to this particular slide just to explain to you the three options that can be used to submit, so that it is very clear to the different colleagues on how they can actually choose the best one if they wish to. But one other thing which we have noticed as well, if sometimes people choose one option because of the information that is available to them, later on they may want to change because they now understand the system better. If that would be the case, even in this instance, you are more than welcome to email the team and then indicate that you have initially registered for this one option and now you want to choose a different option. We will be able to change it for you, because the business ID, once we have registered, it will sort of remain the same. So there's three options now that we use, and one is the CSV files. In other words, those templates that are available on the website and ohss.nioh.ac.za. and you can find some of the updates there. So when you register, you just need now, if you want to use the manual option, in other words, you want to complete the forms manually, for example, the vulnerability one, which you complete only once, the return to work, which you complete only when there's a need or there's information available, the positive cases, only when there is a positive case, and then the screening information that you do weekly, and again, only when you have screenings that have maybe tested or that have been screened positive for any of the symptoms options that are provided there. And then you go into the next cloud, which my colleagues will explain on how to actually go and do that. What is important, as Nisha has explained, if you choose the manual option, try not to change the format, because when you do that, it then tends to make the process of even analyzing the data or accepting your data a bit tricky for us. You can still do as Excel, but CSV is preferred because we can automate it much better. Don't submit PDF documents or Word documents. But if you are not sure, or there's some information that maybe in our templates you seem not to understand, or you may not have it, you are more than welcome to email us, and then we should be able to guide you on how to do that. The second option is more an automated one, which is the API integration. The colleagues will also explain how that happens, where you may have systems already in your environment and you want to hook them directly into our system so that the process becomes automated and you don't have to manually do it. There's not a lot of companies that do this, but those that do it, we'll have to then onboard you, work with your technical team in order to automate that particular process. But once it is done, at least, we get the information seamlessly. There is also the CIMO platform, which a lot of the colleagues are using. Actually, the CSV and the CIMO platform, we have a high number of users. So in this particular instance, CIMO, once you register, you will get in then the username and the password that you can use to log in onto the CIMO website. And as the data becomes available, the 4 templates that Nisha spoke about, you can then go there and submit because it's on the web portal. But Herman will explain this a bit later. I think one key thing when you are submitting your data so that we can be able to use it is the issue of your ID or your user ID. So just make sure that if you have been given your business ID, you use it because it's only this one user ID, business ID. You use that even if when you change, for example, let's say from CIMO to the other. I know in CIMO, sometimes people can use the first part of the business ID, but if you are able to just keep using the same business ID when you submit weekly, that will be really appreciated so that you don't make any number and stuff like that. One thing you could do just on the templates is you could, like in the cases of employee ID or something like that, especially for screening, those numbers could be unique to you. And then just make sure that you understand what they mean, because for screening, we don't necessarily need the real ID number, except I think just for the positive cases. And I think as Nisha has explained, there are various data sources that we are pulling in, and then once these data sources are pulled in, we are then able to work with them. So in terms of the surveillance system, these are the 4 data sets that we are focusing on. The vulnerability assessment data, which is collected once, just once, or when, for example, vulnerabilities of employees change. And I've seen some questions where some people might have issues providing this. I would suggest that people look at the charter document that explains also the legalities behind some of this information. But here with the vulnerability data, we don't want it to be linked to a specific individual. So you don't have to put an ID or something like that. We just want to understand the vulnerabilities in the environment. Symptom screening, as we have explained, we only require this once a week. You can submit once a week, and then we should be able to give that. There's no ID that is required here. It's just for us to understand in the business how many people have, for example, been screened positive for any of those symptoms. If there are no screening that have taken place in the week, then we don't need that information, or if there was no person with symptoms, then we don't need that. The positive case data, I think Nisha explained, and then return to work. Obviously, I will come back later to explain the issues of the data. Once we have your data, what do we then do with it? What sort of analysis do we get? What sort of reporting is actually required as well from the legal point of view for us to report and advising other stakeholders like NCCC and so on and so forth. So these, if you look at this particular slide, that's mostly the outcomes that we are looking at to understand the summary of COVID-19 infections, per industry, and identifying high-risk employees and so on and so forth, because this then can aid decision-making. Chair, I will stop here for now. Again, just to show the colleagues in terms of the technical questions and maybe some administrative questions, you can send an email to ohsworkplace@nioh.ac.za. We will try to respond to you on time, because sometimes we receive a lot of these. It can take maybe a day or two for us to respond. And on the portal, you have everything, including these videos, where you can, for example, if you didn't attend or you want to just to see the explanation, you can find it there. Thank you, Chair. We can go to the next presentation. Thank you.
Thank you very much. That was Dr. Jabo Mtsweni from the CSIR, who has followed Professor Nisha Naika, as a colleague has just reminded me. I'm now going to hand over to Mr. Faisal McKenna from the NICD IT department. I have a slight technical problem on my side, so I can't access my files with the bio details, and I will go through the bio details as soon as I've got that sorted. For now, I'm handing over to you, Faisal, on how to submit the Nextcloud platform. If you could just please share your presentation and just check if your audio is working. In the meantime, a reminder again, we are oversubscribed today for our maximum of 1,000 attendees, and we have a YouTube live streaming happening of the session, as well as indicating that this information and all the presentations and videos will be available for you online on our website and the YouTube channel. So please tell your colleagues who couldn't manage to get into the session and send them the YouTube link. We would appreciate that. For now, I hand over to you, Faisal. Thank you very much.
Afternoon. Can you confirm whether you can hear me, Mr. Chair?
I can. Your audio is perfect, as well as your slide is maximized on the screen. Please proceed. Thank you.
Okay, perfect. My name is Faisal McKenna. I'll be showing you the manual submission. I'm quickly going to show you two slides. The first one, it's just a reminder of the templates that's available on the website, nrh.ac.za, the 4 templates that's available there. And then you've got an option of either taking the template and saving just the first part of the Excel sheet, just the first sheet, and then upload that part. The other two, the list and the dictionary, is just to guide you on what you need to fill in terms of what's on the Excel sheet. And then you can also do then the CSV format of that same template that you will upload. Okay, then the next slide shows you where you're going to do the actual upload, which is your next cloud. We call it nxtshare.nicd.ac.za, and then there you'll be requested for a username and password, and then the username and password would be the username and password that we will provide to you after you've done the registration. Now I'm going to try and quickly do a demonstration. Before I take you to the demonstration, once you log in, you'll get to this screen where you'll find there's 4 folders where you can upload your outcome, your positives, your screening, or your vulnerabilities. So I'm quickly going to try and do a demonstration. If I can get to my, okay, let's share that. Okay, so basically nxtshare.nicd.ac.za, Sorry, typo. Okay, here it will request for your username. I've just done a test name for me for the demonstration purposes. Click login. There's the 4 folders that I was talking about, and then I'm just going to demonstrate how to upload one of. I'll pretend as if I'm logging, going to upload positives. I'm going into the folder. You'll see there's a plus sign. You click on the plus sign, click on upload. It will take you to your desktop. On your desktop, wherever you've saved the files, you click on, in this case, we are going to do positives. I've got a positive template there and I'm uploading it. It will give you an indication that it's busy uploading. Once it's finished uploading, just waiting for it to finish the upload. Okay, it's done with the upload. Your file is there, and then you are able to log out. So just one other thing, let me just try and take you through the navigation. So that will take you to your home, the little home there. You've got a plus sign to upload the file, and then right in the top right hand corner, you've got where your name is, and that will take you to the logout screen. I'm going back to my slides. That was a demo. And then if there's any questions, Mr. Chair will take the questions and then we'll answer them as need be. Thank you very much.
Thank you. That was Faisal Mokena from the NICD section of the NHLS, the National Health Laboratory Services, having dealt with how to submit using the Nextcloud tool and platform. I am now going to hand over to my colleague, Monty Rambau, who's also from the NRH's IT section. And he's going to deal with the question of how to submit using API. And a reminder to everybody, we have reached the limit of 1,000. Please let your colleagues know they can follow us live on YouTube. And if they have any questions, burning questions that are not answered, because I think we are probably going to get through quite a bit in the Q&A session, then they can always email us at info@nih.ac.za. info@nih.ac.za, and the team responsible for the OHSS platform will certainly be able to respond to them through that. And at this point in time, I hand you over to Monty. Monty, I see your slide is fully maximized, but just checking up then on your audio.
Thank you, Chair. Am I audible?
Perfect. Thank you very much, Monty. Please proceed.
Thank you. So I will be presenting the API submission aspect of the OHSS system. So the registration to submit via API, basically as the colleagues have explained, you would register your company. Then after that, upon company approval, you will receive credentials to our test API. This is where we would test out how your application is pushing data into a data lake. And from there, once we have verified the information, that's when we will provide you with production credentials. And below, and then over here, we have the API submission process. So basically from your side, you would authenticate to the API. The API will respond with a token, and using this token and your business ID, you will be able to push the data into our data lake. And for every push, the API will respond with a message and a status. So the API basically has 6 endpoints: a login endpoint, a logout endpoint, an endpoint for submitting the screening symptoms, the positive test data, the return to work data, and the vulnerability data. On the test API link, we have made use of the Swagger user interface so that you can visually see the expected data models and response models. Okay, so the login endpoint. So with the login endpoint, you are required to provide your username, which we will provide, a password, together with your API key. And depending on your credentials and the correctness of it, you will receive a response model back, basically, which will be a token if your authentication was successful, the status, 1 for success, 0 for failure, and the message, either displaying success or reason for failure. And below is the response that your application will receive. Tokens basically are in this format: status and messages, and obviously the URI that you'll be using to push this data. And the same format goes for when you're logging out of the API after submitting your data. Just a point of note, the API will automatically log you out after 15 minutes of no activity. And again, this is the response you would receive from the logout API. And all of this is available on the API documentation. So now I'm just going to go through the 4 data models that the API would be expecting. These are based on the templates available on the NIH website. The only difference is the data is separated from the business ID. So we would be expecting in this instance, the screening data array separate from the business ID. And in here, I've sampled data of what the API is expecting and the format in which it's expecting. We've received multiple requests on the update attribute. Currently, we request that you default it to 0, as it's going to be used on the next version of the API. So in here would be the screening data model, and here would be the positive data model, the return to work data model, and the vulnerability data model, and the expected data types. And so on the endpoint, on the test API user interface, here you can submit your sample data if you want to test out your credentials or the API according to the models that you have built on your side. So the production API can receive up to 1,000 records per push, and the method we utilizing here is the put method instead of the post method. And as mentioned before, the session will be automatically logged out after 15 minutes of no activity. Thank you. That's my presentation, Chair.
Thank you very much for that. That is Monty Rambau from the NIH's IT department. Thank you, Monty, for your contributions. And questions will also be dealt with in the Q&A section. I'm encouraging all of our presenters and panelists just to make sure that they look at the questions in the Q&A box, and then in that Q&A box answer the questions that are relevant. Consider some of the key themes that are there for our Q&A section, so that if I've asked a question, that question and that part of that theme could perhaps be raised by you again and highlighted in the Q&A session as presenters. So thank you very much for that, Monty. And now I have the pleasure of asking Mr. Herman Leroux of the CSIR to deal with the topic how to submit on the CMOR platform, and that includes the creation of reports. I hand over to you, Herman.
Good afternoon, everyone. Just a quick check to see if my mic is fine.
Your microphone is perfect. I'm just waiting for you to share your slides, Herman.
Okay, I'll share it quickly. And I assume that is visible?
Yes, if you could maximize it for us, because I think it's in the other mode. Thank you very much.
There we go. Good. I'm going to go rather quick through the slides because the slides will be made available as a PDF file, so you could use that as a reference. I would also like to do a quick online demonstration. So first of all, this is the agenda. I'm not going to spend time on that. This is the registration process. I think you already understand this from the previous presenters. This is just the steps in which you have to populate your data. And then if you select the CMOR option, please remember that the CMOR option is only for submitting individual records. It is not intended to upload bulk of files at one sort of at a given time. So the option is available for individual records to be submitted. CMOR works very well on the Google Chrome browser, on Firefox and Apple Safari. Unfortunately, it is not supported on the old Internet Explorer, Microsoft Internet Explorer platform. And Microsoft Edge, although it might seem that it works, it doesn't actually work. So if you experience any issues with your browser, best is to use the Google Chrome browser. The address is shown there that you have to visit from your Google Chrome browser to be able to access the CMOR platform. Just some tips on logging in the first time. Please make sure that you use the correct username. It's the NIOH dot and then a number. So just as an example, I will use 9999 as my login today. Just make sure that there's no space between or before or after the full stop between NIOH and the number. And then also when you use your password, make sure to use the capital A and then no spaces before or after the password. And then there are steps on how to update or change your password at the end of this, this guide, which will be made available. There are 4 types of records. The previous panelists already outlined the data model. They mirror the same, exactly the same data model, positive return to work, symptom screening and vulnerability. And then as one of the panelists also outlined, please make sure to use the correct business ID, not your company name or any other number. The best is to use the full number. You see there the 8. It's quite a number of digits, but the easiest is to copy and paste it from your registration email. Just make sure not to include a trailing or a leading space or the colon that is in the notification email that you will receive. This ID you will have to submit once for each of the types of cases that you will submit. And it's also per operator, but once you've submitted the business ID once on the platform, the next record that you will submit, you won't have to retype it or repaste it every time. This is basically the basic steps on how to submit a record. I'd rather want to show this on the platform itself, but this is obviously a good reference for you. And then also, I will just confirm that this platform was developed. It's a cross-domain platform. And it is made for a full HD display. So sometimes if you do have issues with your display, you might have to zoom out a little bit on your browser to be able to see certain things. I'll demonstrate that on the platform as well. These are the records. I'm not going to spend time on those. and then just some interesting aspects around the map display itself, and how to ensure that the map display could be used to your own advantage. The data that you submit is not geolocated. It doesn't have to be geolocated, but the system does allow you to geolocate your data, and that could be of your benefit. Obviously, if you've got a single office in a single location, it might not be of any use to you, but it is still open for your own usage. There's also the option to use the mobile application. Some of the steps are here. There's also a mobile application user guide that is available from via the NIOH. It is a bit daunting to enter some of the data on a mobile device because the questionnaires are quite long. There's a number of fields that you have to do. So it might not be that practical to do it on a mobile device, but we do find that some people are using this nevertheless. This is how to change your password. This you would be able to find in the guide when it is distributed and so forth. So I'm going to quickly switch to the portal. So this is what you will see when you want to log into the CMOR portal. I'm just going to log in as I've got 2 user accounts that I would like to demonstrate. This is the user account without any data, pre-captured data, so there's no data in this platform. You can easily switch between different maps. That's not required for this application, but it might make your experience different. So you are welcome to change those. It won't affect the data that you capture. The most important part is the new event button. So once you've logged in, you can immediately start to log data. So if you click on new event, it will give you the 4 options. I'm just going to select vulnerability at this point in time. And I'm just going to show you that if you type in a business ID once, I'm not going to answer any of the questions now. I'm just going to log a example. You can then also click on the map if you want to. That is not necessary. It will automatically then take the lat long. And then you have to type a description. And this description does not get posted through to NIOH onto their data lake. It is, again, for your own advantage or for your own use. So you can decide to put a number there or whatever. That data is not passed through, but it does help you to manage and track the things that you've submitted on your site. But you have to put a description. If you don't put a description, it will give you a red required field there. So I'm just going to create this event so that you could see how an event is created. It's straightforward. You can then also go back and you can edit the event. You can click on that little edit button there, and you can go and set any of the data fields as required. It will immediately be updated. There you can see this on this open one, it was updated. If I go back and I click again on it, it will reflect that. So if you do updates and so forth, data is submitted into the NIOH data lake every evening. So if you do an update now and you do an update tomorrow again, there might be a possibility that that update might not have gone through to NIOH because we don't resubmit records every day. There might be an indicator on this record that it is has been changed, so that it might post it into it. But best is to do fixes on your records before the end of the day. I'm just going to show quickly how to submit another vulnerability. There you'll see it filled in the business ID. That is just an example business ID, and obviously that is not a correct business ID. If I now go for a positive test one, I'll have to do that again, but I only have to do that. I only have to do that once. The next time I log a new positive it will fill in that ID. So obviously you must ensure that that ID is correct. We also found that some operators are logging data for different businesses. So every time you log something, the business ID must be correct. So the operator ID is not important. The business ID is important. So that is really, I also mentioned, I'll just show you how to zoom your browser. At the moment, my browser was set on 90%. You can move out. So sometimes what happens is if you're on a low resolution screen, you might not see if you open certain things. The box might be actually on the side hidden. So you will have to zoom out a little bit. I'm just going to log out of this account quickly and log into an account that has got a slight bit more test data in it. I don't want to show any live data because some of the data is obviously, as you might be aware, very, very sensitive. So here I've just logged a few records. It's not many, it's a couple of examples of each of the types. I'm just going to log an additional one there. There you'll see my business ID is already pre-populated. I'm just going to call that R3, and I'm just going to locate it on the map. So what I want to show you now is how you can do reports for yourself. There's different mechanisms of reporting. I'm just going to show the one. If I've got a few minutes more, I'll try to show the second one. This is the analytics option. You access it through the main view menu option there at the top right. It will take a few seconds to load. And then once it's loaded, you can then click any of the featured reports. So if I click on this year's events, it would automatically extract that data for me. Here you can see this is a distribution, day of week, day of month. You will see I prepared for this presentation on the 9th. I tested something on the 11th, and that was actually the vulnerability that I just submitted right now. So there you've also got some different options that you could look at, and here as well. This is a time graph on the right. This is a time view of what we've done. This is a distribution. If you've only submitted data from 1 January to the end of January and no other data, obviously the distribution will be very similar to a time graph. But if you select day of month and you've submitted data for January or February and March, obviously it will show a distribution for the day of the month. You can also visualize some of the things because I've put most of my data in that region. It will automatically go to that option. You can also generate heat maps, and you can also use different map visualizations. What is now also possible is you can add your own type of reports. You have to give it a name. And I'm just going to select this month because I know I've selected, I've created my data in February. So there is the 4, we call it tags, or the 4 templates. You can select, maybe you would only want to show positives. At the moment, there will be always be only one group that is really relevant. So don't have to change that aspect. And then this is just regions. So if you have got your organization is spread over the country, you can also then filter it by region. So you can save this, and this will give you all the positives. I've logged only 2 positives as example data. So there you can see the positive data. So this can be done. It is quite easily. You can do detailed reports where you can specify certain things, and you can do certain selections and so forth. So you can go and refine your reports and save them so that you could easily rerun them. That one that I've just created now, if I just click on it, I can rerun it. I can also export the data to Excel, just clicking on the Excel button there, the export button. And then once it's exported, you can open it up and you can get your data in Excel. Oh, sorry, what happened there? I just would like to, sorry, I just see my screen closed. Oh, there it is. So there's also an option here. You can also directly click on that Excel button and just export the data.
Herman, apologies, Herman, you just need to share your screen again.
Ah, sorry, did it unshare? I don't know.
Yes, I think that was probably the glitch. I've also had a little bit of a bad IT and technical day today. But there you go. Your screen is back up, but not.
Oh.
Yes, I see featured reports on the CMO platform.
Okay, yeah. What I was busy showing there, you can also export directly by just tapping the Excel export button there. It will immediately export the data, and that is the same data. If you create a basic report, you will only get basic details around the things that you've submitted. If you do detailed, you will get all the data fields. Again, if you create your own reports, it will allow you to export that data to Excel for your own purpose. So that export doesn't have an effect on the submission of the data into NIOH and so forth. Just to give you a sort of an idea, this is some of the data that was now submitted onto the platform over time. So this is just a cut of some of the data. There you could see, if I show week of the year, because we started roughly around year, this is when we tested the system and so forth, but most of the data got submitted around this week 40 of the year. And obviously now that spills over because this is a distribution. So we now in this week of the calendar year. And here you could see you can get quite a bit of rich data if you have submitted data on your site here. It is visualized per week or per month. And you can also select different options there. So just to give you an idea of how the data is aggregated, there's some different options here so that you would be able to see certain numbers and so forth. So there again, there's also different options because people don't necessarily use the geolocation. You will find a lot of incorrect data points in terms of geolocation. Again, that is not important. NIOH is not using the latitude, longitude information. That could only be used for your own purpose. So I think that sort of concludes what I wanted to show. I think otherwise I'm going to steal too much of the time. Thank you so much.
Thank you very much. That was Mr. Herman Leroux from the CSIR on how to submit on the CMO platform, and giving a very practical live demonstration there as well on that particular platform. I now need to quickly hand over again to Dr. Jabu Mtsweni, who's going to deal with the dashboard overview, also from the CSIR. Dr. Mtsweni, is your audio open, your microphone? I can see that you shared the screen.
Yes. So I hope you can see the screen and you can hear me.
Yes, thank you very much, both. Please proceed.
Cool. So I'll be very brief so that maybe we can give time for the questions. Once the data has been submitted, obviously there will be a lot of things that happens in the background for us to then analyze the data so that there could be reporting. So I just wanted to highlight two things. I'm not going to focus too much on the whole of these elements here, but I think that is why it's very important for the data, in order even on your side to even receive some of our reports, that the data that is submitted, it is validated and it's used templates that we have provided. Because once that has happened, we are then able to do data analysis and visualization, as Herman was showing on CMO, but that's just for the CMO part only. And whilst on this particular case, we combine everything, and we can then even maybe give you some indication of what the data looks like. When we do the analysis, we don't, for again, confidentiality purposes and privacy, we don't reveal any names of the companies, of which companies has what. That's not necessary for us, but at least we want to understand very basic things. Like if you look into this, is more from the business registration point of view, where we can understand how many companies have registered. We can also use some of this information to understand how many are submitting and how many may be having problems to submit and stuff like that. And from which sectors are they coming from? You know, how many people are they employing? What are the ratios around that, including the different proportions with regards to the job categories and so on and so forth. So this is more from the business registration point of view. So we have that information, which may not necessarily be useful to you, but to us, it is very important to understand the compliance and they understand who is submitting and who may be having issues. We also understand as well which different options are the different companies using, so that we can also have a sense in terms of where there are technical issues, like if maybe we need to have sessions like this to support you because maybe you may be struggling or not understanding a certain thing. So if you understand now, we have the Nextcloud and CMO, which are the highest used, which the Nextcloud, the manual one, which is used mostly. Now, the other tricky thing is sometimes it happens that when people register, maybe it's because of one reason or the other, they don't indicate, but I think we have addressed that now, so it should not be a problem. And then in terms of the screening, and I'm just giving you a highlight so that you can have a view of why some of this information is important for us, including the Department of Health and the decision makers. In terms of symptom screening, we obviously want to know which of the symptoms are more prevalent so that you know, we could be more proactive, especially when we go into these different waves and understand maybe what are some of these symptoms people are likely to show before they can be tested. And I've seen in the chat, for example, sometimes people hide their symptoms and stuff like that, but some of these could also assist, you know, for people to understand what are some of these symptoms. And you would notice that some of them are very, very minimal. As time goes on, we tend to realize that the bigger ones, obviously coughing, you know, and the sore throat, and then tiredness and stuff like that. So this is what we see, and then we can break this down into various elements in order to understand what is happening. And I did put a disclaimer here that we have received a lot of data from businesses, but in some businesses, we are still, you know, struggling to actually clean their data, put it in the right format, because sometimes they don't submit in the correct format. In terms of the positive cases, and again, as much as we are asking for for IDs for purpose of correlating with NICD data, with regards to positives, we look, for example, when there was a positive case, how many of those positive cases had symptoms, which ones did not have any symptoms? And you would notice that most of the data that we get, people tend to have symptoms when they have tested positive. And then we also look at the jobs that are affected, or in terms of the provinces, you know, where Gauteng, of course, they are the ones who are submitting most at the big provinces, which is not necessarily a surprise. We also looked at other aspects, especially now if you look at the risk factors, you know, and I know many colleagues mentioned that sometimes there are a bit of discomfort with the submission of data from employees in terms of submitting the vulnerabilities. What we don't need personal details there, but we just want to understand in terms of the high-risk employees so that various decisions could be taken, including when they do the vaccine rollout and so on and so forth. So if you check here, you might notice that, you know, employees that will be more vulnerable are skilled workers and workers who are sort of more in the forefront, and then the different vulnerabilities are noted there. And I noted there was an indication in the questions of some companies may want to put in maybe vulnerabilities that are not on this list. Please let us know. And then Nisha and the team, they can look at it and see if those deserve to be updated in this. We have a little submission here, in other words, a low submission from organizations here. And then we understand maybe it's because of some of these particular concerns, but we are hoping that you would assist us to actually get more of this information. And as I've said, you don't have to link this information to any employee name or ID or something like that. It's always anonymized. And then we also have a situation of once an employee is positive, some of them may be hospitalized, some of them may not be. So this is some of the information that companies may provide with regards to, so that we can understand as well, from the vulnerabilities right up until a positive case to hospitalization, which of the sectors are more likely to be hospitalized based on the vulnerabilities and the jobs and stuff like that. And then, as again, not all companies have submitted this data, and then we would really like that you assist us in this regard. And here, return to work, it's both cases, whether they've been hospitalized or not after they return to work. And then as a last slide, so that I can give back to the chair for questions, in order for us to improve, so that we can also share, maybe weekly or monthly reports with yourselves, even if it's at the high level, so that you can understand what is happening in the workplaces, and the data needs to be submitted and provided. Please use your unique business ID and use the relevant submission option. If you want to change, send us an email. Do not submit duplicates. By this I mean, if you have submitted positives last week, you don't have to submit them again today. Or when you submit them multiple times, then it takes a little bit of effort for us to work with that. But we really appreciate all those who have submitted so far. And there was a question about the risk factors. Only when you have updated them, for example, now maybe in the second wave, you find that the vulnerabilities may be a bit different, we can submit those, you send it to us, and then we can assist you. So that's basically it in terms of what happens to your data. All the information is available on the NIOH website, including the templates, including the reports, the videos, and stuff like that. I think I might have shared the link on the many questions, and some of them, it might just take you to the registration, but if you just remove the OHSS in the beginning, you go directly to the NIOH website. At the bottom there, you should be able to find the templates and the submission guidelines, the charter documents, and the rest. Thank you. Chair, let me take it back to you.
Thank you very much. That was Dr. Jabu Mtsweni, also dealing with another topic, the dashboard overview. And you've just also answered a key question that one of the participants asked online with regard to where to go to download certain things. And somebody else has asked for the relevant email address, I think, to send the CSVs to. So that was Dr. Jabu Mtsweni, who is the head of the Cyber Information Security Center at the Council for Scientific and Industrial Research, the CSIR, and research fellow at the University of South Africa, UNISA. Dr. Mtsweni is involved in leading and supporting and implementing large and complex information and cybersecurity projects locally, internationally, including projects and large state-owned enterprises in South Africa and in Africa, government departments and the military. His research interests and technical expertise are in the digital security, digital transformation, data analytics, software engineering, cybersecurity, and cyber crimes. Now, that's a belated bio for you, Doctor, but it gives our attendees an idea of the capacity and skills that is being brought to this particular project to ensure that all the security and other aspects are thoroughly complied with. And then your colleague, obviously, is Herman Leroux. He's been also with the CSIR since April 1998, and is at present the research group leader, command and control systems in the defense and security cluster. He's involved in command and control technology as applied to the whole of the government initiatives across diverse domains, including defense, safety and security, public transport, disaster management, health, and the protection of infrastructure and natural assets. Interest includes information fusion, artificial intelligence, interoperability, modeling and simulation, and software engineering. Leroux completed a master's degree in computer engineering at the University of Pretoria in 1999, focused on pattern recognition. He's also presented papers at various international conferences, published in local and international journals, and authored 2 book chapters, with a 3rd in progress. Again, just an indication of the quality of the contributions we've had. I've taken up that extra minute or 2 that I've had just to quickly share that with you. You obviously have heard from Professor Nisha Naika, who's associated both with the University of Witwatersrand and the University of Johannesburg, if I've got that correct, Mr. Faisal McKenna is our ICT infrastructure support lead at the ICT. And our own Monty Rambau in the NIH is got 16 years experience in IT from support services, service infrastructure and application development and support. A .NET full stack developer, currently the lead developer for the Occupational Health and Safety Information System, OHSS, which is being rolled out not just in South African health sector workplaces, but also in other African countries. And he's also Occupational Health and Safety Surveillance System, which we are talking about today. And Monty is our analyst developer here at IT. That was just a quick introduction to our colleagues. We are open for questions, everybody. You have typed your questions in the Q&A box, and I've asked my colleagues to have a look there at the Q&A box and look at some of the questions that have not yet been answered. I know we didn't get all of your questions at one stage. We were close to 80 questions. We're now down to under 40. And for the themes that have come through in the questions, I'm going to ask my colleagues just to speak to some of the themes and go back immediately to Professor Naika, Nisha. If you could just talk to some of the questions you found in the question and answer box, answered or unanswered, and perhaps address some of the key ones. Nisha?
Yes. There were a few that were common, and I think the first one was, if you have a business with less than 50 employees or less than 50 employees per site, should you still register? The answer to that is yes, because you still need to submit positive case information that used to go to the Department of Health, but they're no longer processing that information. They just send it to us. So if you have a business or a work site with less than 50 employees, you register on the system and you only need to submit the positive case data. The next one relates to that, is that the work from home, do you need to still submit? The answer again is yes. You will submit the positive case data for that individual or employees that are working from home, because we are collecting information on all positive case or positive employees, and down the line, as Java mentioned, we will be looking at the impact on the businesses, so we need that information. When to start submitting, so you need to, or when to backdate, you backdate till the 1st of October when the directive came into effect. There were quite a few questions regarding the medical data. Should this be submitted? It is not compulsory to submit the actual, this is on the vulnerability template, to submit the actual diagnosed disease. You can only submit that if there is consent from the employee. So for instance, if the person has hypertension or diabetes, you will not share that information with us unless you have consent from the employee. What you will do is that you fill in all the information besides that, saying the person is vulnerable or no, not vulnerable. The other one was adding extra information. The system doesn't allow you to add extra information like your risk assessments, etc., or other information you want to add. It will only accept the information that has been specified for the occupational health and surveillance system. So those 4 templates basically on all 4 systems. So, and we will not be able to use email documents. So if you fill out the templates, you cannot email it to us. You need to upload it on the system, on the Nextcloud, or use CMO or the API access. So we will not be accepting email documents. We generally send those back to you to upload on the system. The next one was, I think after Herman nicely showed us the reporting on CMO, just to note that the API system or the Nextcloud does not generate reports as the CMO system does. What you will be able to see is the overall descriptive analysis on the dashboard that Jabo has demonstrated. So those were I think the main questions that I've got. There were quite a few questions from about the compensation commissioner or compensation fund and submissions of those claims. You know, information on that should be obtained from the compensation commissioner. and I'm sure they have information on the website. But if you're unsure if it was a workplace contact, you can still submit a claim, and they usually will do a very thorough investigation to see whether the claim should be approved or not. So yeah, I think those were the main things that I've picked up. I'm sure the other panelists or speakers may have more input. Thanks,
Thank you
Ashra.
very much for that, Nisha. Over to you, Dr. Mtsweni Jabu. Do you have any specific questions that you've either answered or that remain unanswered that you think is critical to just touch on now in our Q&A section? We've got about another 4 minutes, and I just want to keep a minute for other colleagues as well. Jabu.
Yes, just a quick one. I think our colleagues probably who could not join, I would just want to repeat with regards to where all the information will be available from. I think on the website, the link will be posted, because I think many people are asking about that. And then there are questions about, I think Nisha tried to also answer this, where the vulnerability template may not cover certain vulnerabilities that people need to report on. And my suggestion is if they can just contact us on the email, and then we can see if there is a possibility for us to just adjust the template should the need arise. And then the question that keeps on coming as well is somebody has chosen Nextcloud, now they don't like it. They want to go and choose a different one. Fair enough. They must just send us an email, and then we will be able to convert it. Somebody was also asking, do they need to recapture all the data they may have done on one system? No, there is no need for that. I think, yeah, the questions keep on going up, but I think many of them are more or less similar. But I think let me give to our other colleagues who may answer specific things. Thanks.
Thank you very much. This is certainly a very popular session. It is certainly oversubscribed, and people have lots of questions. There are some repetitions. I'm going to quickly ask Herman Leroux if there's anything in the questions there that you want to highlight, one or two, please.
Yeah, so there was the question about the visualization. If you're able to import your data somehow into CMOR, you would be able to visualize it. The problem is if you imported it into CMOR, then it will again be submitted to NIOH. So that is something that you will just have to take into account. And then there was a second thing. Yeah, some people did actually manage to import because CMOR does have a bulk upload facility, but that is not part of this deployment of CMOR for this specific case. However, if you manage to get that working and your data shows up in the left-hand column, as if, you know, in the same manner as if you added individual records, if your data is there and it's correct, it will load correctly to the NIOH data lake.
Thank you for that. And in the last minute or two, is there anything specific, Faisal, that you want to highlight for our attendees, keeping in mind these are very important tools and an important national platform that we want to strengthen and ensure that everybody adds. Before you close, also just to confirm that the details on the screen now is the essential details that people need to know in terms of the link as well as the email address. Faisal?
I just want to thank everybody for attending today's session. It is nice to see so many people attend and willing to participate in getting people healthy at work. It is a good, very great concern for all of us that has people that reports to you. And even you as a normal employee, you do feel that if your employee is looking after you, and it's a nice thing to have to come to work in such an environment. What concerns to Nextcloud, it's just let's make sure that we follow the template and we don't shift columns around. And yeah, that's it basically from me.
Faisal, and those details on the screen, I hope I'm sharing the right slide there that shows the link and the email address. Is that correct, right?
I'm not seeing
Oh,
The
there's no
slide,
green slide there.
no.
Apologies. I thought I was sharing that slide. What happened? This was the slide. I'm not sure if it's visible now.
Yes, now I can see it.
And is
Thank you.
that correct?
That is, yes, the NIH.
The link as well as the email address.
Whose email address is this?
My understanding is that this email address, Anisha, is this the right one for the people to get back to the OHSS team?
Yes.
Yes, it is. Yes.
Okay, so thank you very much, everybody. These are our panelists and presenters, Professor Nisha Naika, Dr. Jabun Tsweni, Mr. Herman Leroux, Mr. Monty Rambau, and then the last voice you just heard there saying yes was Mr. Faisal McKenna. All thank you very much for your contributions to just highlighting to a bumper audience and with bumper number of questions the importance of the OHSS system and how people can effectively use that. And so I am now going to close the session. I see some people are adding thank yous to our Q&A box. It is a pleasure. There was a certain number of compliments also for the presenter team for the information you shared, and I think the simplicity of your explanations and how to use the tools. Thank you very much to all the presenters. Before the presenters leave, just have a quick squiz through the Q&A box, and if you could just perhaps close and say, dismiss perhaps some of the questions that you feel has already been answered, so we can have a quick look if there's any questions we may need to follow up on. And so this is the end of our particular webinar brought to you by the National Institute for Occupational Health, a specialized division of the National Health Laboratory Services and sister institute to the National Institute for Communicable Diseases, the NICD. We've dealt with the topic COVID-19 occupational health occupational health surveillance system, the OHSS, for South African workplaces, and an update on the session that was first dealt with on the 20th of October. And the recordings and presentations and all the resources linked to even that previous session and this particular session is available on the NIH website. Please visit the website. There's a wealth of information that is there that you can then access, including all of the other webinars that we've held. And on the YouTube channel are all the recordings of the webinars we've had. Please visit these resources. They are available free of charge, and our website is free for those using the major mobile service providers, and no data will be charged when you go to our website. This system is a critical system. We need to strengthen it. The session was planned for today in order to inform you, play your role in ensuring that we keep the workplaces safe, as Faisal says, and for you to upload everything that is required to be uploaded on the system. So at this point, I say thank you very much for joining us here today, and goodbye. See you on our next session.